Here at PBI, when the season gets started, we encounter a lot of players that are having discomfort in their throwing arm. The most common injury that we see is pain in the bicep and tricep area. Typically this happens with kids under the age of 15 because their throwing arms are not conditioned before the season starts. So they're kind of overloading their muscles and they get a little bit of pain either in the front of their arm here, right in their bicep, or in the back of their arm, which is in their tricep. Kids under the age of 16, more so with kids ages 10 to 13 or 14 especially, we see growth plate injuries of the elbow. The growth plate is located right here on the inside of the elbow. The growth plate is essentially is tissue in between the bones, which will eventually ossify and become bone. But until they get to the age of 16, for most players, it's very susceptible to injury. Again, the pain will be felt right on the inside of the elbow, and if you're getting complaints in that area, it's something that needs to be taken very seriously. Over the age of 15 or 16, elbow issues in between the funny bones is a definite serious issue. You can talk about Tommy John surgery. The UCL, the ulnar collateral ligament, is a ligament that essentially is the only thing that connects your lower and your upper arm. And it goes through a lot of stress through the pitching motion, especially if pitchers aren't throwing with proper mechanics, and especially if their arms are not conditioned to be on the mound. It's very susceptible to injury. The typical treatment protocols for these injuries usually starts out with rest. A lot of times you're going to hear kids, well, they'll see a doctor looking at diagnosis, take 2 weeks off of throwing, and take some low-level anti-inflammatory. Some doctors will recommend physical therapy. Some doctors will recommend to continue throwing at a level where you feel no pain and work your way through it that way. The way we do it here is we throw through these injuries. If it's a serious injury, you're not going to be able to throw it at any level. If it's an injury that's not as serious, there will be a level to where you can throw without any type of discomfort. And this is how we get our bodies back in shape, because there is healing power in throwing. With all the injuries that are going on out there, a lot of people are afraid of throwing. If a kid says his arm hurts, the first thing most coaches do is tell him to shut it down, stop throwing. When that's really one of the worst things you can do in most cases. But you have to test these injuries to see what level that they're at. With all the experience that I have dealing with arm injuries and rehabbing player after player from these injuries, the one thing I learned is you have to pay attention to your body. You have to pay attention to the warning signs that your body's giving you. Sometimes it could be an annoying feeling. It's not painful, it just doesn't feel right. It could be a tightness or a grabbing of your shoulder or elbow. It could be a low-level pain to a high-level pain. The bottom line is the earlier that we catch something, the easier it is to fix it. So if you're feeling any type of pain or discomfort, there's no need to panic, but you want to make sure that you get the right advice going forward. With the experience that I have in dealing with these injuries, I can help you evaluate where you are right now and help you devise a plan to get you back on the field healthy.